Hello, everyone. It's Good Friday. What a blessed, holy day for all of us, or for most of us, and surely of the Christian faith. You know, I would just say just this: we want to offer up a happy Easter to all in this great state. We continue to trend without the unreported deaths in a really positive way. I would say, we have had 7 deaths since Wednesday. If you'll remember, on Wednesday we had 2, and on Tuesday we had 2. All this is trending in the right way, but I would tell you just on this wonderful, blessed holiday, I want you to really remember all these folks in your prayers. Please don't let them be alone. If you know any of these families and everything, reach out. A kind word, a wonderful call is so good. But reach out in whatever ways you can, and if you don't know them or whatever, you can always reach out in prayer. So again, I want to wish everybody the happiest Easter, and now I would tell you we've lost 7 additional people. Our 2,677th death in West Virginia is a 99-year-old female from Jackson County. Our 2,678th death, a 91-year-old female from Ohio County. Our 2,679th death is a 77-year-old male from Raleigh County. Our 2,680th death is a 67-year-old male from Greenbrier County. Our 2,681st death is a 41-year-old male from Raleigh County. Our 2,682nd death is an 84-year-old female from Berkeley County. Our 2,683rd death is a 97-year-old female from Ohio County. Our 2,684th death is a 74-year-old male from Jackson County. Our 2,685th death is an 83-year-old female from Putnam County. Our 2,686th death is a 72-year-old female from Hancock County. Our 2,687th death is a 79-year-old male from Fayette County. Our 2,688th death is a 94-year-old male from Harrison County. Again, we've almost lost 2,700 people in the state of West Virginia. We've absolutely got to know just how devastating that is to all of these people, all these families, all their loved ones, and like I said, a very sacred time of year. Please keep them in your prayers. We have 420 new positive cases in the last 24 hours. Our daily positivity rate, 3.48. Our cumulative positivity continues to fall. It's at 5.25. Our active cases are up, 6,642. Our recovered cases, 133,323. Just look, from the standpoint of our active cases and our recovered cases, that widening has closed up just a little bit. We don't want that to happen. We now have 3 counties that are red: Jefferson, Berkeley, and Raleigh counties. We got to be careful. We've got 2 counties up in the Eastern Panhandle we got to watch. We've just got to be really careful. As a reminder again, if you're 65 or older, especially you, and you get this kind of uneasy feeling, whether it be anxious or tired or headache or whatever, please just go get a test. You can't take that kind of chance. Please go get a test. We can really stop this with the antibodies if we know it early enough. Our vaccine eligibility, the vaccines are available, to anybody 16 and older and everything. From the vaccine distribution update, we're at 92.6% administration rate right now for our first and second doses. We want to absolutely be at 100%. You know, we have now reached an official milestone in West Virginia where 500,000 West Virginians have been given at least one dose. And to date, West Virginia has administered 518,543 first doses, 342,851 second doses, for a total shots in arms of 861,394 total doses. That's good stuff, really good stuff. But here's the best stuff. For the population 65 years of age and older, we're striving to get to 85%. You know, we have now put 239,726 doses in individuals' arms for the first time, 189,000 in the second dose, and literally many, many lives have been saved. You know, we thank our Veterans Administration, our federal pharmacy partnership with Walgreens, and on and on and on. Again, I want to continue to encourage, especially everyone at the age of 65 and older, please go get your vaccine. All West Virginians age 16 and older can pre-register now. You know, as far as a manufacturing outreach, we're reaching out to our manufacturers and our businesses and to set up private clinics and everything, as well as reaching out if any pastors or whomever it may be, you know, leaders of your church would call in, we'll come there and vaccinate your congregations and you know, their you know, family or whoever it may be. You know, just give us a call. From the standpoint of our churches, if, like I said, if you're a church pastor and you want us to really come and really be able to vaccinate your congregation, call us. From the standpoint of the COVID-19 vaccine info line, it's up there. The vaccine reminders are all up there. You know, it is absolutely your best defense to wear this mask. I know we don't like them, but wear the mask anyway. I mean, for a little bit longer and everything until we get through all this. It's really important, really, really important. You know, get tested, West Virginia. You know, it's free. The testing map's all up there. The drive-through pharmacy testing with Walgreens and Frith has been very successful. We thank them and thank them and thank them. Our long-term care facilities, we have 8 outbreaks. Our churches, we have 7 outbreaks in 5 counties: Harrison, Kanawha, Fayette, Raleigh, and Nicholas County. You got to watch. You got to watch. We have 93 total cases in our churches now, in 7 active outbreaks in 5 counties. We have to watch. In corrections, we have 9 inmate cases, 13 staff. It's still really good. We're surely watching there. We're going to get to our correctional facilities and start vaccinating there immediately. The guidelines are all up. I told you about wearing your face covering. I've given you over and over and over encouragement to give blood. I continue to ask you to do just that. Now, there's a couple other announcements and everything. This is about our higher ed and the people stepping up and doing really neat stuff. Today, I'd like to recognize a new initiative, the WVACS team that is helping with our vaccination efforts all across our state in a big way. This is a partnership between Higher Ed Policy Commission, the National Guard, the DHHR, that is training health science students from our colleges and universities to support the efforts of our vaccine clinics. So far, more than 1,000 students have signed up to complete the training and help our communities throughout the spring, summer, and fall. Already, more than 100 students have completed the necessary training and have been deployed to help our clinics all across our state. You know, it just goes on, but it tells us in every way that, again, our higher ed folks are stepping up, our students are stepping up, they're getting on the job training. It is really, really good. We thank them in every way. Good, great stuff. Now, we got these numbers yesterday, and to be perfectly honest, I just, you know, we've almost become numb to good numbers. You know, I say over and over, what's my job? My job is to first and foremost look after the health and safety of all West Virginians. My job right behind that's to mind the store, to look after the economics of all West Virginia. Because if we get the economics right, we're able to do more and more and more for our services, for all of our different people in the state. And if they're upside down, you can't fix the roads, you can't provide services, you're dealing with cuts all the time, you're spinning around with a blindfold on trying to pin the donkey. You know, you just absolutely have got to totally always realize that while the health and safety is paramount, you know, or paramount, the absolutely, it is, you've got to have someone really watching the store. Well, we've done that. West Virginia is continuing to pump more and more and more surpluses. You know, West Virginia's general revenue collections for the month of March came in $27.4 million above estimate. Over and over and over, we keep doing it. You know, that's because we've got West Virginia trending the way West Virginia should trend. Year to date, the general revenue collections in the state of West Virginia are $235.4 million above estimate. That's 4.8% above the prior year's receipts. It's good stuff. We keep moving and moving exactly how we ought to move, you know, and just to tell it like it is without belaboring and going on and on about this, this is why, with the world looking at West Virginia and saying how great West Virginia is doing, from handling the COVID situation to the vaccine administration, nursing homes, all of the good stuff we've done, the world is looking at West Virginia right now. I said right off the get-go in my first State of the State that we have got to do something about changing our image to the world, because they just didn't have any idea how good we really are. Now, I'm telling you that right this minute is our time to put us on a pathway to eliminate our personal income tax. If we wait, we're going to lose time. You're going to lose that spotlight that's on West Virginia if we don't watch out. We don't need to wait. But we've got to craft this thing to where we're really sure that the folks that are out there that are struggling a little bit, or maybe the folks out there that are just kind of getting by, we don't put this on their back. We've got to be sure that every wage earner, every class that we go through, whether it be a 10,000, less than 10,000, or it be above 100,000, everybody stays cash positive. We've got to make sure of that, don't we? Now, if we can do this, we will pump so much money into West Virginia's economy. We will put it back in the hands of the people and let them decide what they want to do with their money. That's exactly what we should be doing. From a standpoint of traditional Republican value or Democrat value, surely more of a Republican value, to be for growth, to be for putting money back in the hands of the people. Absolutely, without any question, that's what it ought to be. Now, or that's what it is. Now, with all of that, with the surpluses we have today, with the spotlight that's right on us right now is when we've got to move. I want everybody to know, without any question, my plan, you know, we can tweak and change my plan, and I have welcomed it every way in the world. There's 3 plans that are out there right now. West Virginia does have surpluses going on. West Virginia's health is good. Absolutely, without any question whatsoever, we don't want to get in a such situation to where, and it's happening, It's happening right in front of us, to where the rich, out-of-state interest lobbyists are controlling the whole scenario. And the way they're controlling that is just absolutely the swamp, the Charleston swamp, not the Washington swamp. This is the Charleston swamp. They get what they want, don't they? They absolutely, without any question in my mind, all of our coal companies should step up, and when things are really great, throw a few pennies in the collection plate. My companies are willing to do that without any question, and I'm going to get hit harder than anybody. You know, we should absolutely do that from the side of our gas people. Our soda tax people have not had an increase in their tax in 70 years. Now, without any question, I've said over and over, from the standpoint of beer, wine, and liquor, my numbers were out of kilter. We change them. That's what we'll do, just change them. But I just announced on Metro News, and I am announcing now, I am calling a summit of the people from the standpoint of the minority party and the majority party in both the House and the Senate and everything on both sides. I am calling both the minority and the majority leaders and their finance chairs to come to the Cultural Center at 12 o'clock on Monday, high noon on Monday, and we're going to have a summit on the most important item that has come across West Virginia's desk forever. And that is how we can merge the three plans or come up with another concept and put those plans into action and absolutely make it to where we can get this thing across the finish line for the people of this great state. I want everybody here to just know one thing. From my standpoint, it is mandatory. It is mandatory that we do not lay this burden on one sector in order to benefit another. We cannot do that. We need to spread this out to where absolutely we have the opportunity right now to make everybody cash positive. We have absolutely the opportunity to bring a lot more people to our state to stop this decline in growth. Think about one thing. Let me just ask you just this. We've lost 2,688 people in West Virginia. How are we going to replace them? How are you going to replace them? They're gone. How are we going to replace them? The other thing I would ask every single person here, if an average household, there's 732,000 households in West Virginia. If as an average, every single one of those households is going to have an extra $1,483 in their pocket, what are they going to do? They're going to do exactly what we all do. They're going to spend their money. It will stimulate our businesses like you can't imagine. And as we get rid of the other 40% as we move forward, that amount of dollars that will go to every single household forever as an average. Every household as an average will probably approach $2,400 a year. What are they going to do with their money? They're going to spend their money. And absolutely that is with zero growth. When they spend their money, there'll be more dresses sold at the dress store. There'll be more guns sold at the gun shop. There'll be more soda drinks drank. There'll be more beer sold. There'll be more everything going on within our economies. And not only that, people will come. Now, if you don't believe people will come, you're really missing something. But that is not the story. The story head is how we put money back in the hands of West Virginians and stimulate our own self. That's the story. So at 12 o'clock, let's quit messing around. Let's bring all the leadership together. Let's present all the different ideas. I'm perfectly willing to compromise in every way on my stuff. I've said it 1,000,000 times, and with all that, I want to do one other step. Let's bring the media there. Let's bring the media right there where they can see everything that's going on. I am 1,000% transparent. This situation is so important to the state of West Virginia, it's unbelievable. Bring the media there, not for questions, just to view. Bring the media there. Let's be 1,000% transparent. Let's don't hide behind closed doors. Let's absolutely be 1,000% transparent, and let's address the most important issue that will propel West Virginia forward. If we can't get anything done, let's forget it. Let's forget it. And let's absolutely know that just one thing for sure will happen. COVID will leave soon, and right behind it, the stimulus dollars will leave soon too. And we've done a lot of stuff to put West Virginia on a glide path to make West Virginia better. But when those two things leave, if we continue to lose population in West Virginia will continue to dwindle. Services will go down. Absolutely, it'll make it tougher and tougher on the folks that are here because West Virginia will dwindle. We have got to find a way to grow population in the state of West Virginia. It's the only state in the nation that's not growing. And we got to do that without putting a burden on our small businesses or on the backs of the needy or on the backs of anybody. We do not need to featherbed our lobbyists, our rich, out-of-state lobbyists. We do not need to featherbed people that are representing people from out of state that are trying to be unreasonable. Now, I don't want in any way, any part of hurting the soda pop industry or the tobacco industry or the coal industry or the gas industry. No way, no way, no way. But there's no point in us being hogs either. We absolutely should all step up. This is an opportunity for West Virginia beyond belief. And the other last thing I'd say is just this. From the Senate side, I love the fact that they went big. From the House side, if you're not ever going to get there, why go? It's too small. Why are you going to get? How are you going to ever get there? You know, from the standpoint of the Senate side, I love the idea of maybe doubling back and helping our sub-S's and our C schedule. You know, but we just got to find a way to do it. And the way I think is it's got to be to do it. Everybody's got to play a part of this. We can't just say, well, we're not going to do anything to the Coal Association because they got a bunch of lobbyists here and everything. We're not going to do anything to the gas people or the soda pop people because they're all running around promising campaign funds and everything else to everybody. That's what they do. We can't do that. We just can't do that now. This is too important to our people. And so I'm trying with all in me. We're going to give it our best shot, and I welcome, like I said, we can't have 5,000 people from the media there, but we'll surely have media representation, and I hope we'll make real progress and we'll be able to get there. Now, a lot of people said this, and I want to add in by just saying this. A lot of people say, well, why don't we go to special session? And there may be a situation to where in the last 6 or 7 days or whatever this may be, that we have to extend for a few days in order to be able to get to a resolution or an answer. But really and truly, West Virginia, every day that you let go is a day the spotlight is on us, a day that we can do it. I'm announcing today a March revenue number that came in $27.4 million above. I'm announcing that we're $235.4 million above. Do you really believe we can sit back now and say, well, let's don't do it, let's do it next year? And you know what you're going to awaken to? You're going to awaken to the spotlight on us will be long gone. If you say, well, let's put it all to the summer, we lose more spotlight. Now's our time. Now's the time. Anyway, thank y'all so much.
All right, thank you, Governor. Let's now go to Dr. Clay Marsh, our coronavirus czar.
Well, good morning. The governor shared the news that I think is really very important for us, which is that many things have gone really well in West Virginia. And that's something that we are all very proud of. There was just an article that came out from the Long-Term Care Association groups that demonstrated a 96% reduction in COVID cases among nursing home residents and a 90% reduction in death, which is substantially more than we've seen across other sectors. And West Virginia was the first in the country to vaccinate first and second shots in all of our nursing home residents' arms. So that's something that we should feel very, very proud of, and undoubtedly saved a lot of people's lives. And that is the very good news. Now, let me flip to what is the challenge that we're facing still. Because we know in many states, and starting to look at states that are repealing their mask mandates and looking at states where people are becoming more careless about wearing face coverings, masks, and physical distancing. And we start to look at the spread of variant viruses around our country. And we know today that at least 30%, probably more like 50% of the viruses are becoming the United Kingdom variant. We're also seeing the rise in the number of United Kingdom variant cases in West Virginia. We will have a quantity on that and report that next week. But we are seeing more positive tests being confirmed to be variant viruses. And as we've talked about, the real concern that we have about these variant viruses, and particularly the United Kingdom variant, which is the one that is the most rapidly growing, is that it is more infectious, about 50% more infectious, and it is more lethal, about 50% more lethal. And around the world and in this country, we're seeing younger and younger people not only getting infected by this particular variant, but getting really sick and ended up in the hospital. And we know today that as we look at our population, and the governor said today that we've passed 500,000 at least first shots in arms, which is fantastic. But looking at European countries, we know that the countries that are doing the best have at least half of their population vaccinated with at least one shot in arm, which is the United Kingdom, or even better, has at least 2/3 of their population with one shot in arm, which is Israel. And despite the United Kingdom variant growing quickly in those two countries as well, they have been able to see a much, much reduced number of people going to the hospital and also controlling the spread, the current spread of this particular variant in their country. So I say that not to scare people, although I think it's important to recognize that nobody has a pass on being at risk for getting COVID-19 today, young people included, but also that it is very, very important that each West Virginian who is right now able to qualify, if you're 16 and over, for a COVID vaccine, should absolutely please choose to be vaccinated. We know that these vaccines are remarkably effective, as I talked about in our nursing home population, which prior to vaccination was about 50% of the deaths that we saw in West Virginia. But also the way that we keep these variants from spreading, from infecting more people, is by having more of us be immune. And we know today that having vaccination gives you better immunity than just recovering from native COVID infection. The combination between native COVID infection and vaccination gives you the most immunity. So please choose to be vaccinated. Please, let's take our 16 to 18-year-old high school students. Let's get our college students. Let's get our young West Virginians up to 30 or 35 years old. Let's get vaccinated. You are at risk of having severe consequences of becoming infected with COVID, but also that you are at risk for spreading these variants to more vulnerable people in our state. And as we continue to push up and lead, as the governor said, and go from now 33 to 35% of our population with one shot in the arm, to 50% of our population with one shot in the arm, to 2/3 of our population, then we will be the place that is able to demonstrate how we can slow that transmission down. And we're fighting this COVID battle on two fronts, as we've talked about. Right now, we really do want to get young people and their families vaccinated to slow down the transmission, the spread, to slow down the rate of these variants, United Kingdom variant particularly, in moving, but also continue to vaccinate and buy more time so that we can vaccinate all other West Virginians. We want the rest of the older West Virginians, or Save Our Wisdom group, our younger West Virginians, particularly those with pre-existing medical conditions. So it is really our time to shine. It's our time to stay together, and it's our time to make sure that we're doing the things that can protect ourselves against this really terrible and deadly disease, but also that we can protect each other as we've done the whole time. So thank you.
All right, thank you, Dr. Marsh. Major General Jim Hoyer, Director of the Joint Interagency Task Force, and Dr. Aina Amjad, our State Health Officer, are also joining us today and are available for questions. Secretary Bill Crouch is still out with a family illness. We will now go to questions from members of the media. The first today from Charles Young with WV News.
Hi, this is Charles Young with WV News. Governor, I wanted to ask you a little bit more about the summit you've called for with lawmakers. Could you talk a little bit about, the specific things you're willing to compromise on? I know you said, there's elements of the Senate plan and some of the other plans out there that you do agree with. What are the elements of your plan that you are willing to compromise, or that you're willing to compromise on? Thank you.
Charles, there's all kinds of elements, really and truly. As far as the beer, wine, and liquor, I think it's out of kilter, and we need to reel that back in a good bit. From the standpoint of the percentage, if we're at 60% and we wanted to lower that to 50% to be able to get there in that way, and bring in some portion of the C schedule or the sub S people and everything, we could do that. From the standpoint, Charles, the points that, if you'll just look at the methodology of how I tried to put it together. Here's how I tried to put it together. I tried to put it together to where everybody in the state would stay cash positive. That's something we absolutely need to do. We don't need to lay this burden on the backs of those that are having a tough time in order to help the backs of those that maybe are the wealthier end. Why in the world we would take off the wealthy tax, I'll never know, because those people can afford that, and it's nothing, and that's all there is to it. I think that it's problematic, to extract money from West Virginia or Marshall or our higher ed institutions and everything. But, there may very well be cuts in there somewhere that I don't really understand or need more knowledge about and everything. And there may be ways to move forward with some cuts that may not have anything to do with a WVU or Marshall or may include, but I think from the standpoint of the biggest things are, we don't need a food tax. We do not need that. That's going to hurt those that are struggling the most, and we all know that. But my very point is, this is not a situation, Charles, to where you've got a $500 million shortfall in the budget, and you just don't have the money anywhere else, and you have to do things. You have to do certain things. In this situation, we're in a situation to where we can reward all of our people without laying any kind of burden on anybody substantial. But the biggest thing we got to do, Charles, is we have to do this. In my discussions with the Coal Association people and the gas, they were willing. They wanted to step up. But they got to step up to some degree. Our soda pop people or somebody has got to step up. This idea of just saying, oh, we'd be for it just so it doesn't affect me. Well, that's not right. That's not fair. I mean, really and truly, we got to have everybody play a part of this because, Charles, you know, the real bottom line is to the whole thing is if you happen to own a coal company or, you know, a gas company or you own, you know, a pop company, whatever it may be, do you realize in this situation that every one of your employees is going to get a pay raise? Every one of them is going to get a pay raise, a substantial pay raise, and you don't have to pay for it. You don't have, the owner doesn't have to pay for it. You know, it's all done by the state. And so, you know, Charles, there's a lot of ways you can go and a lot of things, you know, parts here you can move around and everything. I'm perfectly willing to move the parts. The only things are just this. Don't put a burden on those that are really struggling. Make it cash positive for everybody. And without any question, you've got to go big enough. The bigger you go, the better. The bigger you go, the more money we're going to put in the economy. But you've got to go big enough that where people on the outside really believe you're going to do it. Because if they don't believe, they'll never come. You know, that's basically it, Charles.
All right, thank you, Charles. Next to Kenny Bass with WCHS and Fox 11.
Thank you for taking the question. Governor, when we talked on Wednesday about the Senate plan, which was being talked about in finance and moving to the floor and what the House passed, you mentioned that no senators, that no one in the Senate had spoken to you at all about what was going on with their tax reformation proposals. So how confident are you that since they've already sent a message that they may not be very willing to discuss with you what's going on with taxes, that they're going to be not only in attendance at this summit on Monday, I'm sure they'll show up, but how willing do you think they're going to be to work with you? Since your plan was laid out pretty publicly and everybody had a pretty good idea of what was going on with it, the House went in a total different direction. The Senate is going in a total different direction. And from what we talked about, they haven't said much to you about it during this entire process.
Well, Kenny, I won't back up on this. Naturally, I was really disappointed, you know, that as being as transparent as I've tried to be, that they didn't call or anything. But you know, we don't need to really dwell on the little stuff. I mean, you know, I'll never forget Coach Pruitt said this, you know, at one time. He said, why do we have to worry about the rat pellets that are all around us when there's elephant dupe all around us as well, you know? And, but he didn't say rat pellets and dupe. But now, if you'll just step back from this and just say, from the Senate side, that it really, I mean, there's some really good stuff. I love the fact that the C schedules are brought back in. I love the fact, really and truly, at the end of the day, that we're going big. You know, now, it's just a matter now that all three plans are out there. Let's just all get together and act civil and act like big boys and be transparent and try to get us across the finish line. I saw one of the polls that said 93% of the people are against the Senate plan. Well, the reason they're against the Senate plan, I honestly believe it lays unduly the burden on the people that are struggling the most. And it does. And it takes a little bit from WVU and Marshall and everything. In my plan, I said that I felt like from encouragement from Chairman Tarr and everything that there was $25 million worth of cuts that could come from the Senate side and $10 million worth of cuts where we just have attrition, where we just don't need to hire a person back after a person retires. You know, so you know, Kenny, if they don't show up, they don't show up. You know, there's no question. I mean, let's just be fair again. You know, in all honesty, I've got like a 93% approval rating by the Republicans, and you've got a lot of folks here, you know, especially on the House side, that are absolutely not in touch with the Republican voters. I mean, we need to do the work that the people want us to do. That's all there is to it. This isn't about Jim Justice. But I am telling you, I am in touch with the people. Nobody can deny that. Nobody anywhere is going to deny I won every single county in the state, and I won a primary by 45 points with a competitor that put in $5.2 million. I know what the people want me to do. I know that. And that's what I'm going to do. I'm not going to ever do anything that I want for Jim Justice, no matter what anybody says. Let me tell you just how silly, and how vile at times, people can be. There was an article written in the Charleston Gazette the other day and said that things had gone awry on my finances, and really and truly now, that's why I'm pushing this for me. Are you completely kidding me? Really? That's just about as true as I can fly through the sky. Really? You're talking to the person that doesn't take a salary from the state. If my income, were $200,000, and I could save half of that now, I'd save $6,000. If I could save all of it, I'd save $12,000. Do you really, really believe that $12,000 is going to make me try to do something that is going to benefit me? Are you absolutely crazy? We don't need these crazy thoughts, and we don't need this vial pumped out and everything only to just hit at something and everything. Think about our severance tax. I am trying to do a tiering on severance tax to where my companies may end up paying a few extra $1 million to put in the pot. And we think, really and truly, I'm doing this so that I can save $12,000 or whatever it may be. Let's just don't do the crazy stuff. Let's all get together, be big boys and big girls, try to work together, be transparent, and try to help West Virginia. That's what we should be doing. We should absolutely all be pulling the rope together and helping. I think the Senate plan's got some real promise, and I love the fact, of the work that Chairman Tarr and President Blair and all the folks up there put in on it. So I'm all on board. If we can just all get together, and I'm sure Eric Householder and everything. Eric does great work, and he's a really smart guy. And if we can get the House, the House and the Senate to start working together, and the minorities, every meeting that I've had with the minority side, every single meeting has been great. They've been willing to jump in and try to help, and they've been really, really positive and optimistic, and they've been anything. They have not been obstructive in any way. They've been really gentlemen and ladies, all the time when I've met with them.
All right, thank you, Kenny. Next to Katie Coyne with the Charleston Gazette-Mail. Katie, your mic may be muted. All right, must be having trouble connecting. We'll move on. Paul Mullen with WCBC.
Good morning, Governor, panel, fellow journalists, and West Virginians. A happy and blessed Easter to all of you. Governor, I'd like to talk to Dr. Marshall on this one. I want to talk about AstraZeneca vaccine. We hear some reports that there are blood clotting issues with that one. And I think Dr. Fauci has come out and said, well, we really don't need AstraZeneca. Number one, what's your take on the problems, if there are problems with AstraZeneca? How will that affect if they don't move forward with that part of the vaccine program? How fast we can roll it out? And maybe looking down the line without even considering AstraZeneca, do you see anything where in the fall, before we send kids back to school, that a COVID vaccine will be part of their vaccine regimen? Thank you.
Okay, Dr. Marsh, it's you.
All right, Governor, and thank you, Paul, and happy Easter to you as well. AstraZeneca vaccine is an adenoviral vaccine that has similarities to the Johnson & Johnson vaccine, but there has been a troubling side effect that has been seen in Europe with the AstraZeneca vaccine. And you're right, in a small number of people, really small, there has been some concern about blood clotting episodes. And there is a medical diagnosis called heparin-induced thrombocytopenia, which basically is a immune-based problem where the platelets, which are the blood clotting factors, get targeted by some of the immune responses and can start to bring those platelets together. And that can cause blood clotting in people. And so there is some evidence early, and this is still under investigation, but there may be something with the AstraZeneca vaccine that in a very, very small number of people can activate that effect as well. Many countries have restarted the AstraZeneca vaccine after assessing that problem, not feeling that that was an absolute reason to stop, but using other types of blood thinners if somebody does have that complication, not heparin, is the way to treat that. In the United States, AstraZeneca had shown promising results, but they mixed some of the data with earlier data and stopped some of the more recent data from being reported. And because of the inconsistency in the way that they reported their data, the Food and Drug Administration has not granted them emergency use authorization, and they may or may not. As you point out, Paul, we do have a growing number of vaccines for the 3 vaccines that have been approved by the Food and Drug Administration. And so it very well might be that AstraZeneca doesn't get approved in this country, but we'll have to wait and see. I do think that with the results coming back from the recent Pfizer trial using Pfizer in 12 to 15-year-olds showing 100% effectiveness in reducing COVID infection, and the fact that we're seeing these variants become much more frequent in our country, and they're growing rapidly, growing in our state as well, by the way, then most certainly as the Food and Drug Administration looks at the data that will come from the Pfizer trial, Johnson & Johnson is doing a similar trial, Moderna is too, and Pfizer is now dropping the age down even younger children to see if it's safe and effective. And as we get these data back, they will be assessed, I think, in a very rapid manner by the Food and Drug Administration. And as soon as the Food and Drug Administration grants authorization, as it has for 16 and above for Pfizer vaccines and 18 and above for Moderna and Johnson & Johnson vaccines, we will be strong advocates of using these vaccines in younger children going to school as well. Because as we said, the way to stop the virus is to slow down the spread, slow down the rate of variants coming in, both of which are done by being careful with masks and all that, but really by vaccination and having time to vaccinate as much of the population of our state as we possibly can. 50% is probably the first hallmark, and then 75%. And we're going to constantly be in a race between new variants coming up and the number of people that we can vaccinate with vaccines that are effective against these variants. And currently our vaccines that we use today are effective against the United Kingdom variant, which is the reason why we really want to speed up and please ask everybody who is eligible to get a vaccine, and that means everybody 16 and above in West Virginia, please choose to get vaccinated. It's very, very important right now.
All right, thank you, Paul. Next, we'll go to Ben Conley with the Dominion Post.
Thank you. A question was recently asked at a Mon County Board of Health meeting about whether or not the county or the state we're compiling patient data on our COVID-related deaths and hospitalizations. Obviously, we know age is an overwhelming factor, but there are other important factors like obesity. So I guess the question is, are we collecting data that would tell us like what percentage of our deaths or hospitalizations were obese and to what degree, or had other underlying factors, maybe like heart or respiratory issues? And if not, do we anticipate that will be done in the future?
Dr. Amjad, this is you.
Ben, as far as our dashboard information goes, we don't have that collected on that kind of information. Each patient that enters the hospital, that would be part of their hospital information that they would be collecting, and it's part of their own health history information. But to collect that, for long-term studies or information, that would be interesting to collect. We do know that obesity is a risk factor for COVID-19. But to have that as on a statewide level, that all that information would have to be collected. We do have hospital data, of course, that we do keep track of as far as COVID deaths and age limit and race that does come out, a couple weeks afterwards. But to get into a personal health history, whether or not someone has obesity, cardiac history, and things like that, that's very private information that would have to go down to a person's personal chart level. That would have to be a research level information that would require someone to do a research proposal and information like that. But we do have multiple people interested looking at other stuff. So I'm sure we have some people interested at the research level that would probably be doing that eventually, but we don't have state level data for that right now. Thanks.
All right, thank you, Ben. Next to June Leffler with West Virginia Public Broadcasting.
Hello, Governor and panel. Thank you for taking my call. I asked about vaccines for inmates on Monday. Since then, I have heard anecdotally from advocates that some inmates have been able to sign up for their vaccine. I was hoping Secretary Crouch might be on the line, but I was wondering if the governor or anyone else on the panel could give us an update on vaccinating inmates.
June, I think I can give you, an update that, from what I've been told, it is executed and it is starting today, and there's a plan in place to move forward with the vaccine. So we're on it. We appreciate the questions and all that kind of stuff. We're on it and we're moving forward with it.
All right, thank you, June. And Governor, I'll turn it back to you.
Oh, gosh. Okay. All right. Well, first of all, happy Easter. And every day, I'm sitting here staring right at these numbers, 688 deaths. What an incredible prayerful time of year it is. And please, send up your prayers for all these great West Virginians that we've lost. I've got to say this. I'd be remiss if I didn't say this, that, earlier on, I said, that there's folks, maybe here that are out of touch with where we are with the voters and where we are with the public and everything. I do believe that. I hope and pray that's only a few. We had just a situation, a very ugly situation that just happened, in regard to the emergency powers. I want everybody to know without any question, I want to continue to be just transparent in every way. I'm not the king. I don't want to be the king. Absolutely. I call on people nonstop, for advice and guidance and everything as to how we should be proceeding and doing things. But I think for the most part, everyone, even across this nation, but surely from the standpoint of the polling and everything that we've done, everybody feels pretty confident in West Virginia that we've handled the health and safety of our people and the monies in a way that was absolutely the right way to do it. We never looked at anything from a pet project. We've never looked at anything from the side of Democrat and Republican. We've done it the right way. And so we do have some people that got in the hall and started screaming obscenities and everything else, that were House members, and it's a crying shame. It's really, it demeans us beyond belief. Special thanks, from my standpoint, to the Senate, to our Senate president, President Blair. He stood by his beliefs and stood very strong. Senator Trump Charlie did a great job in from what I understand in the explanations and where he stands and where for all practical purposes the Senate stood and stands. They had a vote the other day. I don't know if I think the vote was 33-1 on something in regard to this, and it shows in a lot of ways it shows wisdom, does it not? And I thank Senator Clemens. I thank Senator Baldwin. I really believe that when that vote was cast, all but one Democrat said this is the way we ought to go. So, I really believe, and I thank those that stood up for what they think is right, and while at the same time, thank God there's just only a fraction that of people, even though the fraction was probably 15 or 20 House members that, that really their behavior was not good, in fact, obscene at times, and surely out of touch. And so, nevertheless, I'm really glad that they do not represent the House. I am absolutely glad of that, and so we need to continue to lay stuff aside. But for God's sakes a living, if we get this bad, we shouldn't be here. That's just all there is to it. We shouldn't be here representing the people if we're going to be this bad. But nevertheless, I've got to run. I thank y'all so much. They just flashed up and everything. I'm going on Fox News here in 1 minute, so I got to go. Thank y'all.